Hi, Dr. Patino here at the Cosmetic Surgical Center of Cerrito. We're doing a lower blepharoplasty. In other words, we are doing a lower lid eyelid. And the bags that are making you age here, this is the central, this is the nasal, because this is the nose, so it's closer to the nose. So it's the nasal fat pad, and we are dividing it, and I'm dividing it under a Q-tip. Notice the complete absence of bleeding when we do this. If you have a little bit of bleeding here, this surgery is very, very bloodless. If you have a little bit of blood here, the patient can go blind, so it's very important. So we remove a very tiny amount of that nasal fat pad, right? And then this is the central fat pad right next to it, right? And the muscle is in between those, so you wanna be very careful not to get the muscle, right? The inferior oblique muscle is in between these two fat pads. So now I'm removing this central fat pad, again under a Q-tip in completely bloodless manner. And she doesn't have a lot, so this is just a little bit that we are to remove, but notice the complete bloodless field, which is very important. And she does have probably a little more there, but you don't need to take the whole thing out, okay? But what I want you to see is how we do this in a completely bloodless manner. I specialize in bloodless surgery. This is completely bloodless. You see any blood in there, you guys?
No blood.
Incredible, right? Beautiful, thank you. There's a tiny nasal fat pad that we're removing here, but notice how we do it in a completely bloodless fashion. We're gonna put it away, and now we're gonna go and pick up this other fat pad. And so now this is the central fat pad, it's larger, and we're gonna go ahead and also remove it under the Q-tip. And she doesn't have much, and there is not much herniation of this fat. This fat belongs inside and has come out, but it's not very much, and so we don't need to do much here. So we're just gonna go ahead and do it and protect the eyelid and protect the globe with, when we do it with the Q-tip, because if I cut, I can cut into the Q-tip, not into the eyelid or the globe. But notice the complete absence of bleeding. Thank you. I don't want to take too much out, right? So this is the excess skin that we're taking from the lower eyelid, you see? But notice how I cut even with scissors, and you see absolutely no bleeding here at the Cosmetic Surgical Center of Cerrito. Truly bloodless surgery. It's incredible. Look at that. You see? And that's the excess skin. And when we drape the eyelids, you know, it's nice. You don't have to take a lot. The big mistake is to take a lot. And so that looks good, because that's gonna retract. That's very nice. Alrighty, so notice how bloodless this surgery is. It's very important that there is no bleeding here. We specialize in bloodless surgery. If there is bleeding here, then what happens is that the patient can go blind. If we never had that, we want to keep it that way. Thank you. Alright, and so I like to do interrupted sutures here, you know. That way we leave space for any excess blood to come out through the holes in between the sutures, right? But as you can see, there is no bleeding, but if there is even minimal bleeding, if there is a little bit of bleeding, that blood can go and make pressure against the orbit, the globe, the eye globe, and compress the optic nerve, and the patient goes blind. And it's a very serious complication, something that, thanks to God, has never happened to us, and we want to keep it that way. But look how extremely meticulous I am when I do this, you see? Notice how there is absolutely no bleeding and not even bruising. She will be swollen tomorrow a little bit, but not much bruising or bleeding when we do this. But I take my time I do it very slowly and very meticulous, right? And so we remove the central and the nasal fat pads. She didn't have much laterally. There's a lateral fat pad as well on the lower eyelids, but you don't need to take all the fat pads out, and you don't also need to take all the excess fat. She didn't have much herniated, so she didn't need much. Thank you. We're cutting, and yet look at that. Absolutely no bleeding. And this is how much we take out of this side. And you can see that the eyelid drapes nicely. Maybe we'll take a little more, but you don't want to take too much out, because if you do, you can have more problems. But in this case, I think you can probably take a little more out. Thank you. Okay, so I'm taking just a little more, you know? This is a millimetrical thin, man. So there we go. Little more. Thank you. Meticulous to the point of? Being ridiculous. I'm meticulous to the point of being ridiculous. That's exactly right. You got it.
Thank you, doctor.
And she is absolutely looking marvelous, right? And we're gonna do 4 knots on the 4-ball monofrill. And those are interrupted sutures, and we're basically done, you know? Here we go, Gabby. And we'll, Emily. So we're gonna go ahead and remove. It's not that she has blue eyes. It's that those are the, you know. Let's see how these drapes, yeah, eye protectors, so to protect the eye globe. But it looks nice. Doesn't have any excess skin or excess fat. We're gonna do the same on the other side. We're gonna take this protector of the eyelid out, right? So you see that blue thin, see? So we're gonna take this blue eyelid protector and come from this side so you can see how nice this is, you know, no excess fat, no excess skin. And we're done. We're gonna go ahead and do a tummy tuck on the same patient. Thank you. Good morning, Dr. Patino here at the Cosmetic Surgical Center of Cerrito. So what we're doing is we're doing an extended abdominoplasty. And notice how I'm cutting with this knife, and this knife is very sharp. We call it a number 10 blade or a scalpel, right? And you see how there is absolutely no bleeding when we do this procedure here at the Cosmetic Surgical Center of Cerrito. We're gonna follow this up with electrocautery. And this electrocautery looks a little different, you know, it's more sophisticated, but it's just a regular electrocautery. The reason why it looks a little different is because it has an evacuator for the smoke, so we don't inhale the toxic fumes, right? Most surgeons, what they do is they use another instrument. It's called a Yankauer, that not only aspirates the fumes, but it aspirates blood also. This one doesn't aspirate any blood because it's high up here, see? But we don't need it to aspirate any blood. And we do have the Yankauer as well, but we never use it. Why? Because we don't need it. We don't have excess blood. So, and we also don't use any instruments, you know? Everything that you see here is hands. We use our own hands. I find out that the retractors, the instruments that you use to retract, they tear the tissue. So there's many things that go into doing bloodless surgery like this, right? The number one thing that I was telling Nyla is the daughter of one of my first assistants, and she's now almost the age of my first assistant.
Wow, that's crazy.
Carla, yeah, and I see her in Carla. Carlita, we love you, we miss you. And her daughter is here observing this procedure. And I was telling her that, you know, incredible that. Alrighty, so this is beautiful anatomy right here. This white membrane I'm going through right here is carpus fascia, which divides superficial fat over here from deep fat over here. And as we go lower down here, what are we going to find over here, Emily?
Rectus abdominal fascia.
The abdominal wall fascia, which, you know, covers not only the rectus abdominal wall muscle, but also the deeper structures, you know, like where the intestines are and all that. So that's what this is. And notice how Devin is retracting with her own bare hand, no retractors. Yeah, because here, usually this is done with a cat cow retractor, which have not used in many years. We don't even know where it is now. and that's because she's using like her hands to be like that cat cow, right? I think when your mama was here, when Carlita was here, we used to use that instrument, you know. But
the cat paw?
Yeah, but that would tear the tissues and you could have bleeding. And notice the complete absence of bleeding here, Nyla, when we see this, when we do this procedure, is incredible. So this right here is the rectus abdominal wall fascia right here, okay? And this right here is the fat, right? Superficial fat. But Nyla, can you see any bleeding in there?
No.
No bleeding at all, huh?
No.
This is your first time watching surgery?
Yes.
Oh, wow. How's your experience?
It's good.
Yeah? You like it? Yeah?
Yeah, I like it.
You're not getting how do you say it? You're gonna be a nurse, right?
Yeah.
That's incredible, right?
Yes.
Oh yeah. Oh wow. That's very good.
Have you seen it?
You see there's a scar over here? You see a scar right there? See? Right there?
Yeah.
So we're gonna follow that scar. It's right in the midline, right? And now this is the specimen. This is the pubic hair. I don't know if you can see that there is hair there, shaved. We shaved the hair in that area. And this is the specimen. This is the area that we are to remove. And we have a waste management company that comes and removes the specimen. But notice how we do this in a completely bloodless manner. See? Incredible. There's scar tissue here, of course, from the prior scar, but there is no bleeding. This is what we see. It's incredible, right? And we're going to remove all that. Now we're going to go around the belly button, right? She has a beautiful belly button, doesn't she? That's that yellow thing is the iodine that's in there. This iodine, or we call it betadine, right? And that's it's for cleaning, right? It's get rid of the, or not get rid of it, but you know, clean. Yeah, disinfect. Yeah, the bacteria that are in the skin, right? So that's the thing that we do, right? So look at that. This is incredible. No blood here. All right. So now what we're doing is we're gonna basically remove this part of and I marked twice, but I'm gonna go and into this area here, and that's where we're gonna end. But notice how I go down to dermis and there is absolutely no bleeding. The dermis, of course, is an avascular membrane, means it doesn't have any blood vessels, so usually there is no bleeding, right? What do you see? Artery, and there's absolutely no bleeding here. So there's a little blood vessel there, but the bleeding here is minimal, right? Minimal to almost nothing. We're saying that Nyla, you're saying that you went to get your blood drawn?
Yeah.
And tell us the story.
That I saw more blood than what I'm seeing right now.
When you had your blood drawn?
Yeah.
That's incredible, right?
Mm-hmm.
That's true, yeah. It's pretty amazing surgery. And so this is the way we do it here at the Cosmetic Surgical Center of Cerrito. If you would like to have surgery this way, please give us a call. 510-525-7999. We have operators standing by to do your tummy tuck, right? To get you ready, man. Thank you.
So we just removed the specimen on the left side of the patient, and this side it is no bleeding, just the yellow fat.
Thank you.
And here's the specimen from the right side, no bleeding.
Thank you.
What are we doing?
We're depithelializing the belly button.
Yeah, and this is something that is normally not done, but it's a technique that I decided to use on the belly button so that there is no bleeding. There is the only reason to do this during a tummy tuck. We do it routinely during a breast lift, for example, but depithelializing means to take the epithelium, which is the top part of the skin, out, right? And that's my finger right there. So there is no reason to do it here, but I do it so that there is no bleeding. You can see my my glove totally clean of any bleeding. Thank you. Well, muscles is very small. It's not that big. It's very narrow, you see? Normally it's bigger than that, but this particular patient, her rectus abdominal wall muscles are separated, but just a little bit, not a lot. So we just do a little bit only, whatever it needs to be done, right? You don't want to do more than what is needed. And do you see an 8 right there?
Yes.
Yeah, so figure of 8, all proline suture. And so we're gonna basically put those muscles together in the midline where they belong. These muscles get separated. They're twin muscles that join in the midline, and they get separated during pregnancy to make room for the baby to grow. But she is not going to have any more babies, so we're restoring her anatomy to pre-pregnancy state. And when you do these procedures, when you do these rectus plication, usually there's significant bleeding when the surgeon even puts a stitch here. Why? Because the rectus abdominal wall muscle is right under it. Those are the twin muscles that people call, the athletes have. We all have them, but they call the six-pack, right? This is the six-pack that in women gets separated during pregnancy, and now we're gonna put them back together in the midline. I'm doing it slowly. I'm gonna put that stitch inside so it doesn't stick out, right? And but notice the immaculate white fascia. So now what we're doing is we are cutting the burn edge of the belly button. You see that? Burn edge. So we're gonna do the same on this side and cut it with scissors. And notice the complete absence of bleeding when we do this. Incredible. Thank you. Wow, so thank you very much. We're done. So this is, we did a lower blepharoplasty first, and now we did a tummy tuck. But notice how beautiful that belly button is, sinking in nicely. And if you go from the top, can you see the semilunar lines on either side?
Oh, yes.
And this is zero liposuction, and there is literally minimal bleeding. We're gonna say she bled 5 ml, and that's it. And that's from tummy tuck, and the eyelid, she didn't bleed at all. Thank you.